CS Analytical. And today I'll be presenting on USP 661.1 and 661.2, specifically going through the revisions over the 10+ year period that these chapters have been out there in industry, some current challenges that still exist in applying these chapters, and proposing some modern approaches to overcome some of these challenges. So this is the agenda for the presentation today. I'll leave this here just for a moment so you can familiarize yourself with the approach that we'll take. So I'll leave this here just for a moment so you can familiarize yourself with the agenda for today. Just for a brief introduction to CS Analytical, CS Analytical is a CGMP, FDA-registered, and DEA-licensed contract laboratory, and we exclusively focus on container and package system testing. And so really, when we founded CS Analytical, the intent was to be able to address concerns about container qualification from really the full life cycle of that product package system, starting with the individual materials of construction and testing those from a chemical perspective, which we'll largely be talking about today, up to and including final filled finished packaging, which we might be subjecting to distribution simulation, container closure integrity on stability, etc. The founding team at CS Analytical has extensive experience in the contract lab space, again, exclusively focusing on container and package systems. And we've been actively performing USP 661.1 and 661.2 since they were first released in the PF in 2015. So a fairly long history of working with these chapters and perhaps more importantly, interpreting these chapters and figuring out the best way to practically apply them with our clients. And so I mentioned the concept of container qualification and comprehensively over the life cycle of that package system. And, despite this being quite an old document, as you can tell from the date here, the 1999 FDA packaging guidance still, in my opinion, is the single most comprehensive document that discusses the relevant elements that should be considered in selecting and ultimately moving forward with a container or package system for a pharmaceutical product. And this document introduces the concept of suitability, that every package system should be shown to be suitable for its intended use. And suitability has quite a few different elements to it. The package system should be compatible with the drug product it's containing. It should be suitable from a safety perspective and not introduce any risk to the product or the patient. It should be suitable to protect that product that it is containing. And if there are any performance attributes, let's think of a prefilled syringe that needs to be dispensed, that package system also has to be able to perform that function that is expected of it. And so when we think about all of the different tests that can go into container qualification, there are quite a few, and I alluded to some of them prior. What I've done here in this particular slide is kind of outline both compendial type tests that are applicable to package system or components, as well as non-compendial tests, but concepts and evaluations that are almost always built into a comprehensive container qualification and control strategy. And so within the context of the compendial chapters, and in this case, we're exclusively focusing on USP, although, for example, the EP in the EU would be a direct corollary, there are different types of chapters that address different elements of different types of materials and components. And so as you see here on the bottom, there are chapters to address physical and functional performance of systems and components. There are test chapters that evaluate biological reactivity of those materials and components. But what we'll be focusing on today has to do with physicochemical characterization, the chemistry-based tests on those materials of constructions and components, depending on the specific material itself. And so in this particular box, you can see I have 661.1 and point 2, which we'll be talking about rather extensively today. Those are applicable to plastics, but I've also listed USP 660, which is the test for glass, and 381 for elastomeric closures to provide insight into the other types of chapters that are in this similar space. It's important to note that these 3-digit chapters do include prescriptive methods. So there is a detailed sequence of steps for, prepare the sample like this, subject it to these conditions, and perform these analyses and compare them to these specifications in most cases. That is very different from these 4-digit chapters, which are more guidance-based and which I commonly refer to as custom compendial tests. So container closure integrity, extractables, and leachables are great examples where there are not a set of prescriptive steps that you must follow, but rather these documents contain a lot of concepts that are relevant in considering CCI or ENL that you then have to go and evaluate according to your own justification. So just to provide a little bit of a broader insight into the vast array of package related chapters in the USP, I've put together this slide. And starting in about 2013 to 2014, there was a large push to revise really almost all of the chapters in the USP pertaining to package components or systems. And so since this revision cycle started in that time frame, pretty much every single one of these chapters that is listed here has been impacted or updated in some way. And that spans really all the different types of materials from elastomers to plastics, glass, etc. And it also introduced some new chapters, for example, 382, that addresses specifically the functionality of elastomeric closures. So there have been quite an extensive list of revisions over the past few years. There have also been quite a few information chapter updates and also new information chapters that help provide some more context into the tests that are performed in those relevant chapters, how you consider those, and how you can interpret those results. So given the fact that all of those packaging chapters have changed or are in the process of being updated or drafted, it begs the question, why have there been such heavy revisions over the past few years to the packaging chapters in the USP? And it boils down to a few different points. The first one is that a lot of the historical methods did include antiquated, non-specific, and frankly, quantitative rather, tests. And so there were quite a few wet chemistry metal tests, color change titrations, visual inspections for leakage, etc., built into these chapters that are being replaced with much more quantitative analyses, where instead of, let's say, evaluating for color change to determine whether or not lead is present, we're going to use an ICP-MS to quantify the amount of lead in solution, as an example. Over the past few years, or really past probably a few decades in honesty, there's also been a wide expansion of product types and therefore applications. And so a lot of these chapters that have been established for decades really were addressing common product package systems that were around for decades, things like solid oral dosage forms in an HDPE bottle, maybe a parenteral product in a glass vial that's then drawn into a syringe at the time of administration. However, with a lot of new products, there are a lot of new packaging requirements. So biologics, cell and gene therapies, for example, we're looking at polymer-based cryogenically stored bags, polymer-based vials and syringes, etc., and even pre-filled syringes, something that was not necessarily commonplace 30, 40 years ago. At the same time, and partly due to the expansion of different product types and the requirements for storing those product types, we've also seen a really wide expansion in the types of container materials and the configurations of those materials. So we've seen new types of polymers, alloys, novel glass materials, glass treatments, all of these elements that were not necessarily considered or addressed in the previous versions of those USP chapters. And so what we wound up at was a situation in which these old chapters were not necessarily suitable to evaluate a lot of the novel systems and use cases that the market is experiencing today. And so there was a mismatch between what was coming out on the market and the tools that we have at our fingertips to evaluate and qualify those package systems. So drilling down to 661 specifically, what was it about USP 661 that warranted revision? In the old 661, which again had been around for decades, there were really only 5 plastic materials covered. We had high and low density polyethylene, polypropylene, PET, and PETG. These particular plastics were evaluated by a 3-solvent extraction in most cases, such that the material of the container was cut up, put into water, alcohol, hexane, extracted, and then we evaluate for non-volatile residue, essentially total non-volatile extractables that came out of that material. It's very non-specific in terms of identifying what's coming out of that material, and therefore was relatively antiquated in and of itself. However, one of the more, I think, in my opinion, critical issues with that chapter was that all other polymers except those identified above were directed to evaluation under what was referred to as physicochemical tests. And the physicochemical test regimen was a water extract only. And so it was essentially 1/3 of the work that was done for those plastics listed above. In addition, the heavy metals test, for example, did include that visual comparison versus a lead standard instead of something that was quantitative to evaluate any lead present. And so, similar to the point that I made on the last slide, what we wound up with in the case of USP 661 specifically was that newer materials such as cyclic olefins, novel packaging types, novel packaging applications actually received less scrutinous testing than a high density polyethylene bottle for a solid oral dosage form that's been around, used, and well characterized for decades. So, from an application perspective, again, there was a mismatch, but also from a risk perspective, there was increased risk because there was not a vehicle to evaluate many of these newer materials that did not have the proven track record out in industry as some of the previous legacy types of systems and materials. So across all of these revisions, there are some common themes. I mentioned generally the concept of replacing qualitative tests with quantitative tests. This is something that is seen throughout the chapters and is perhaps most exemplified by the concept of extractable metals. So numerous test chapters, 381, 661, for example, have moved away from this color change type test to using validated ICP-MS methods to identify and quantify a range of extractable metals in solution, very much so above and beyond what was historically performed. At the same time, many more materials, dosage forms, and use cases are considered across these chapters. I had mentioned pre-filled syringes before. The concept of elastomeric functionality of pre-filled syringes is now incorporated into 382, for example, whereas previously there was essentially no guidance in the USP pertaining to those parts. This next point is, I think, really critical to stress, and also something that does require more conversation, and we'll get there throughout this presentation. However, one common trend in a lot of these chapter revisions is to provide much less prescriptive testing and provide the user the ability to make a much more risk-based decision, both with respect to the tests that they perform and oftentimes the acceptance criteria that are applied. And so a lot of these chapter revisions, whether they're a guidance chapter or a 3-digit chapter like we'll talk about today in 661, define a set of tools and a set of considerations that can be used to characterize a specific material, component, or system. There's often that supporting information to help you interpret that in an information chapter. And ultimately, there is a little bit more gray area in these chapters today to allow for that end user to tailor things specific to their use case. I had mentioned before that there are quite a few more use cases out there today than maybe 30, 40 years ago. And rather than try to predict and provide stepwise tests for each of those possible use cases, many of these chapters are presenting the relevant concepts as they apply to those different use cases and do allow the end user to build and justify their own test strategy. Specific to USP 661, again, moving to quantitative methods, there are really a lot more details included in these revised chapters relative to the historical 661. So we went from one chapter, 661, to two separate subchapters, 661.1 and 661.2. Importantly, these chapters encompass a much larger range of polymer types and standards. And importantly, they also provide statements and guidance for how to address unaddressed materials. So if it's a type of plastic that's not specifically outlined in 661.1, there's language in there to support the use of the general concepts in 661 applied to unaddressed materials to ensure their safety. It also takes into account product risk profiles. There is different testing proposed for, let's say, a solid oral dosage form package versus an injectable package. And again, this concept of less stringent acceptance criteria. There are sections of the chapters that are explicitly written and say to the effect of inability to meet this acceptance criteria does not mean that the material or component is not suitable for use. Rather, if you do have a result that does not meet specification, the expectation is that you characterize what caused that high result, you perform a risk assessment on the material or chemical component that caused that high result, and you evaluate whether it actually poses a risk to the product or the patient. And that is written right into the chapter, where a failing result in and of itself does not necessarily mean that the material or component is not suitable. So I'm not going to go into the specifics of each individual test under both of these chapters. However, I do think it's important to outline the differences between them. And so from an application perspective, 661.1 is really specific to materials of construction. This is the resin, the additives, the colorant of that particular component, the material from which it is constructed. Whereas 661.2 addresses plastic packaging systems, those final packaging components put together into a final package assembled in tandem. And so one specific analogy that I have used over the years to describe this is that 661.1 is really evaluating that batter, that specific mixture of ingredients, so to speak, that is then used to make perhaps different size bottles or different size caps, for example. And so whereas 661.1 might be evaluating the batter, 661.2 is evaluating the cupcake or the sheet cake or maybe the bundt cake in between that you're making from that specific mixture of materials. From a test perspective, I apologize if some of these are a little bit small. They're screenshots from the USP specifically, but from the specific tests that are performed within these chapters, you can see that from the physical-chemical perspective, there's quite a bit of overlap. So when we perform that extraction, we then test that extract for UV absorbance, for acidity alkalinity, TOC, etc. And you can notice that a lot of these tests are shared between 661.1 and 661.2. There are some specific differences. So identification, IR and DSC are included under 661.1 because that is specific to a material. And by that same token, something like functionality is included under 661.2 because something like spectral transmission is going to be dependent not only on the material, but also on the final shape and form of that bottle, for example. However, a lot of these tests are essentially evaluating the same thing on that extract. So functionally, what is the difference? And that entirely boils down to sample preparation. And so in 661.1, the sample preparation process is to take, in most cases, for most plastics, to take 25 grams of the test material, put it in a flask, and add 500 milliliters of water. This is then boiled under reflux for 5 hours, cooled, and that resulting solution, once filtered, is your C1, is your solution S1. That is the test solution that we're evaluating for those tests that we just went through. In contrast, under 661.2, the sample preparation process is to, quote, fill the packaging system to its nominal capacity with purified water. And if possible, use the normal means of closure and then heat it. I have heat in parentheses because there are a few different heat conditions, temperatures, and times that can be used within the chapter. However, the important thing to note here is that under the 661.2 test regime, the amount of water that's being tested or present in that package is tied to its nominal volume. So if I'm using the same HDPE material to produce 3 or 4 different bottles, there is going to be a difference in, I guess you can say, the concentration of that test solution between, let's say, my 30 cc bottle and my 300 cc bottle, one of which is being filled with 30 ml of water, the other which is being filled with 300. However, under 661.1, both of those plastic packaging systems, that difference in volume is irrelevant because we're taking a constant mass of that material and putting it into a constant volume of water. This concept will become relevant again as we get to future slides when we start thinking about the specifics of applying these two chapters to different types of components and systems. Just as a quick overview, I put this little slide together to just kind of highlight the different types of materials, both addressed by the chapter and unaddressed by the chapter, as well as package systems and components that we have evaluated under these chapters over the past 10 or so years. So I'll leave this here for just a moment for you to glance through. So this next portion of the presentation, I'm going to take you through the history of these chapters from when they were first proposed in 2013 to where we are today in 2024. I have to say that the process of implementing these chapters, I think, has taken a little bit longer than most people expected or anticipated, and a lot has changed over the years. And it can be, frankly, a little bit dizzying, as this next slide shows. And so the intent here, I know this is a complex slide with a lot of stuff on here. We're not necessarily putting this slide here for us to go through each of these bullets. We'll go through them on the next slide. But really, this slide was put together for effect, just to show the numerous iterations that these chapters have been over the past 10 years. So after being introduced in PF in the 2015 timeframe, in 2016, 661.1 and 661.2 were actually made effective in May of 2016. So they fully replaced USP 661 at the time that they were made effective immediately. Importantly, when these chapters, were made effective in May 2016, they included what we refer to now as the grandfathering clause. And so there was a statement within the chapters that said, essentially, that the requirements of these new chapters are met if you test to the new chapter, or if the packaging system has been deemed appropriate for use by a regulatory authority. In other words, if you had already marketed the product and the FDA had approved it with the historical 661 data, there was not a need to go and revise or update these tests for currently marketed products. They also, in this initial release, did include specific extraction profiles for extractable metals and specifications under 661. And unfortunately, this initial release resulted in substantial industry pushback. The scope of change from the old 661 to these new chapters was massive. And there was not necessarily a lot of guidance on when or how to apply these new methods to the vast array of materials, components, and systems that were present and that were expected to be immediately in compliance moving forward with these released chapters. And so what we ran into in this time frame were, frankly, a lot of unforeseen issues in applying these chapters reliably to these different types of materials and configurations. And so in 2017, about a year later, the USP released a revision bulletin, and 661.1 and point 2 re-entered PF. And these major changes of the revision bulletin were incorporated into USP 41 in the following year. The major changes included a reinstatement of the old 661, a 3-year grace period for the adoption of 661.1 and point 2. So that would be May 1st of 2020 at the time. But importantly, at this time, the grandfathering clause was removed. And so the sort of trade-off with industry was, okay, we're going to give a 3-year implementation period for everybody to figure out the best way to apply these new chapters to their product package systems. But as a result of implementing that implementation period, the expectation was that once these chapters did fully become effective, that essentially all marketed products would be supported under these new chapters. And they did at the time, and also personally, I did as well, encourage companies to adopt these chapters early. This was something that a lot of people in this time frame were torn on. Do we try to apply these new chapters so we have nothing to worry about moving forward? Or do we go with the tried and true 661, update at a later time, but possibly introduce some risk if we find something under the new chapters after we've been using the package systems having been qualified by the old 661? So moving forward into 2018, there was another revision. So these major changes from the 2018 Notice of Intent to Revise were incorporated into USP 42. And what happened in this particular revision was that the implementation date was extended an additional 5 years, such that these chapters will become effective on December 1st, 2025. To this day, that is still the implementation date. So that is still the date listed in the USP chapters that they will become effective. Another critical change that occurred at this time was that all of the prescriptive extractable metals testing was replaced with language suggesting a risk-based approach. So rather than saying, perform this extraction, look for these specific metals and ensure that they're present at a quantity of X or lower, all of that was removed, and it references 232 and also extractables and leachables guidance documents to say, evaluate which metals you should look for and propose a test to be able to identify them. And so this also introduced some confusion where, especially for packaging materials and components, most people were used to running those prescriptive methods, checking the box that it meets or did not meet, and moving on. So this concept of performing a risk-based evaluation specific to the USP 661 chapters was a very foreign concept and frankly still can be today for certain organizations. Between the 2018 and 2022 timeframe, there were a few minor corrections, clarifications, and revisions, but it wasn't until December 2022 that there was another substantial change to the chapter, in this case to 661.2. In 2022, a Notice of Intent to Revise was released. 661.2 was put back into PF, and the additions here were incorporated into USP 43, and it's in the state that it is today. What was added here, I had mentioned previously that there are numerous temperatures and times that you can evaluate package systems under 661.2. A less aggressive condition was added at this time, allowing for storage at 50C for 72 hours, in addition to the previously existing 70C, 100C, and 121C options. Another critical change that was implemented at this time was a revision to the TOC specification in 661.2. Previously, there was a single TOC specification that applied to any package system or component tested under 661.2. In this particular revision, the TOC specification was revised to align with USP Chapter 643 on TOC, which establishes different specifications based on the volume of the container. And so effectively what this did was allow for a higher TOC result the smaller the container volume being tested was, which absolutely helped to alleviate some challenges in testing small volume containers, which did frequently fail for TOC. Moving forward to 2024, there was one more minor revision bulletin so far this year, similar to the minor revision bulletin in 2023 for 661.1. This just has to do with the addition of some missing acceptance criteria for specific plastics. However, over this over 10-year period, you get the sense that there have been quite a few changes to both the tests prescribed in the chapter, as well as the acceptance criteria for those specific tests in those chapters. And so where are we today? There have been quite a few revisions, but frankly, there are still some challenges that are present in applying these chapters. And so I've listed out a few here for both 661.1 and 661.2. And in the subsequent slides, I'll talk a little bit about each of these, some of the challenges that they propose, and some ways that we can potentially overcome those challenges. So starting off with USP 661.1, metals and identification tests. So I had previously mentioned that the prescriptive tests and specifications for extractable metals were removed from 661.1 in that 2018 timeframe. In here, again, without prescriptive extraction steps and specifications, the companies, the end users, are left to justify
I don't know
their
what that
approach.
means, but it was like this.
Left to justify their approach as well as their results. Many clients are frankly not used to this, and frankly, there are a lot of people that don't want to justify choosing or not choosing a specific metal to assess for. And so the approach that CS Analytical takes in this case is to perform a full 21 metal screening, referencing USP 232. Where we essentially evaluate according to a validated ICP-MS method for any of the metals that the ICP-MS can detect. And so this screening allows for a comprehensive evaluation of any metals that are present without necessarily having to go and justify which metals we are or are not including in the evaluation based on the materials, based on the additives, etc., which is the recommended approach. And so for that screening test has proven to be a pretty efficient way to generate data to evaluate that specific concept with minimal justification required. Moving forward into some challenges specifically with identification tests. This one is a little bit interesting, but it's also not perhaps the most critical challenge. So to provide a little context, 661.1 states that you really only need to test by either FTIR or DSC, thermal analysis, to confirm the identity of a specific material of construction. However, in the case of IR, there are some complications there. Is it appropriate to compare copolymer material of construction to a reference standard for a homopolymer. This is relevant, especially in the case of polypropylene. So the USP 661.1 does have a set of tests for polypropylene, which can be applied to both polypropylene homopolymer and copolymers. However, the USP reference standard is a polypropylene homopolymer. From an FTIR perspective, you know when you scan a copolymer that it's polypropylene. It looks very similar to the homopolymer standard. And there is language in the USP that states that minor differences in the spectrum for materials are acceptable based on variations in formulation, etc. However, if the intent is to confirm the identity, I'm often left in a situation where I can confirm that the material is in fact polypropylene, but just based on the IR, it's not always feasible to establish whether or not that polypropylene is a copolymer or a homopolymer. DSC thermal analysis will tell you that. A copolymer of polypropylene will have a substantially lower melt point. However, in the case of polypropylene and thermal analysis, again, you must compare to the homopolymer standard. And so there is the possibility that technically the DSC result would fail, would not match the melt point of the homopolymer, which is expected. So there are some of these kind of incongruous statements and standards specifically with respect to ID. Another example of that would be DSC for polyethylene. Again, let's say in the case of HDPE, the USP reference standard is a homopolymer. There's not a description of homopolymer versus copolymer for polyethylene in the USP chapter. However, there is for polypropylene. Yet, in practice, there are copolymers of polyethylene that exist and that we get to test sometimes. And so there's not necessarily a clear-cut vehicle in 661.1 to differentiate between a polyethylene copolymer and a homopolymer. Lastly, another concept with respect to DSC, specifically the thermal analysis, is the impact that certain processing steps can have on that material of construction. And gamma irradiation is a fantastic example. So it's fairly common for folks to perform identification testing, even as part of, let's say, incoming inspection, etc. And gamma irradiation specifically can impact the thermal analysis of polymers. It can change the melt point. And so, again, there's not necessarily a vehicle within 661.1 today, especially for thermal analysis, to say essentially that there are variables that can impact the melt point of a material, and that just because the melt point has changed does not necessarily mean that the identity of that material has changed. It could very well still be polyethylene that happened to undergo gamma irradiation. The melt point has changed and it doesn't match the homopolymer polyethylene standard for HDPE that has not undergone gamma irradiation. So technically that would be an OOS. However, in practice, it's feasible to describe how there is an impact from gamma irradiation, show before and after those test results, and essentially demonstrate that the material that you have is in fact the material that you believe it to be in HDPE. Another challenge specific to USP 661.1 has to do with the concept of obtaining representative mixtures of materials. So as I previously mentioned, 661.1 is intended to evaluate materials of construction. And those materials of construction really are intended to be inclusive of additives, colorants, etc. Anything else that's going to be added to that base resin that makes up that final material of construction. However, oftentimes there are additives, processing aids, and especially colorants that are added to that mixture during component manufacturing. And so when we're buying, let's say, that base resin, and manufacturing bottles out of that resin, we're probably going to be mixing other things with that resin to form that finished bottle. Um, and in this case, it's not really feasible to test additives or colorant or master batches alone. They're inevitably going to fail. And so what we wind up in is a situation in that oftentimes the final formed component, let's say that 30 cc HDPE bottle example that we've been using, that often winds up being the most representative form of that mixture of materials of construction. It includes all the additives that the resin would have had. It includes the colorant, etc. However, the issue here is that the USP says to test individual components by 661.2, not by 661.1. And this is something that I think is a particular challenge, as we'll go into on this slide here. So we just addressed why a final formed packaging component might be the most representative way of evaluating a material of construction because it includes all of those additives, colorants, etc. However, 661.2 states that components may be tested, but that they should be submerged in the nominal volume of the final container. So essentially, take that final component, put it in a flask, and add water that is equal to the quote nominal volume of the final container. In application, there are quite a few issues with this. One, as an example, you could have something like a cap, and that cap might be used with a whole range of size of bottles. That there's not one particular nominal volume that is appropriate to test with. At the same time, if we're taking that entire component and submerging it in a nominal volume equal to the container, that's going to introduce the opportunity for a lot of non-product contact materials to get into the extraction solution. So if we think about adhesives, paper in liners, the backing of, let's say, a CRC cap, or even in the case of blisters, any adhesive or paper-backed lining, submerging that material in water and extracting it is going to be wildly different in those cases than filling that component or that package system that's assembled using those components with water to its nominal volume. And then the third issue with this is the concept of surface area to solvent ratio. And so again, previously I had pointed out in the sample preparation slide that 661.1 includes taking a constant mass of material and putting it into a constant volume of water for extraction. And so what we wind up sometimes here, if we were to test components under 661.2, is that all else held equal, we can have materials that pass under the 661 setup, where that surface area, or rather sample to solvent ratio, is controlled, that can wind up failing under 661.2 when we apply that nominal volume concept. So again, if we take that example of a cap and a bottle one step further, if I have to submerge an entire cap within 30 milliliters of water, that extraction is going to look very different than taking 25 grams of material and putting it in 500 milliliters of water. And so the way that historically I have approached this, even going back to when these chapters were in PF, and still to this day, is to largely test components themselves by 661.1, especially if those components are of a single material of construction, like that HDPE from that bottle, or that polypropylene from one of the layers of a CRC cap. By doing this, we provide that representative mixture that the component possesses of the colorant and all the additives present in it, but we also provide a standard sample to solvent ratio that's based on mass. And so this, in my personal opinion, allows for a more direct evaluation of that material itself, allows for a more direct comparison of different materials, and then we test that final system using those components and using those materials under 661.2. And so I'll provide some examples as well of what that might look like from a broader testing strategy, incorporating both 661.1 and 661.2 into the overall testing strategy. But sticking with the concept of volume as a challenge, under 661.2, volume is also a challenge for final packaging systems as well, not just for components. And so for solid oral dosage forms, something that we run into fairly commonly is that a lot of package configurations don't have a nominal quote unquote volume. So a bottle might have a 30 ml or 60 ml, et cetera, nominal volume, but stick packs, pouches, sachets are not usually expressed with respect to volume. They might be described as a 2.5 gram stick pack, for example, or they might be described specifically based on their dimensions or length. Um, Additionally, many of these systems are not really intended to hold water. So you can get some paper-backed pouches for maybe some pills, etc., that can introduce some issues here. And so our approach to these types of container systems is to determine the fill volume in a very similar way that we would to bottles. And we typically agree with the client on the fill volume to be used. So if we receive a stick pack, we'll evaluate realistically what can we fill that stick pack with in terms of water that still allows us to seal that stick pack, but does have sufficient volume in there where we can combine multiple stick packs and perform the test. This approach is something that we take instead of risking underfilling. So if we were to take, let's say, the volume of a single tablet in a pouch, that wouldn't necessarily be realistic because we're really going to substantially underfill that particular package system, possibly yield high results simply as a function of putting a very small amount of water in there. So that is the approach that we take specific to those types of package systems that do not have volume explicitly stated. On a very related note, on the other side, perhaps, of the scale, there are some challenges with 661.2 for very large volumes. So we've had requests over the years for 661.1 or 2 on large volume API or bioprocessing bags, 55-gallon bulk storage drums, etc. And realistically, it's not feasible to fill and extract a 55-gallon drum inside of an autoclave or an oven. The inclusion of this 50C option might allow for storage in an accelerated aging chamber for 72 hours. But it begs the question, for bulk and in-process packaging, is 661.2 even really appropriate? Is it better to test those materials of construction by 661.1? Or perhaps is chapter 665 more relevant? 665 is a chapter that is effective in 2026, I believe, that talks about testing strategies for plastic systems used in manufacturing. Bioprocessing bags are a great example of that. However, bulk storage containers are still a little bit of an open question. There is not necessarily language in any of these chapters that directly address the concept of bulk storage. And so putting together a justifiable approach is, a responsibility of the end user. So another challenge with respect to 661.2 is one that was identified all the way back when these chapters were first in PF. And that is evaluating blister packaging by 661.2. So remember, 661.2 involves filling that package system to its nominal volume. In the case of blisters, that's really related to the cavity. Um, it's often difficult to prepare water-filled blisters for numerous reasons. Oftentimes, our clients don't want to shut down their manufacturing line or sealing line. Micropipette a controlled volume of purified water into each individual cavity on the sealing line, start back the sealing line, send it through the sealer, and hope that there's no vibration that causes water to jump out, causes issue with sealing, etc. And so the reality of it is that I have had probably one client over the past 10 years and probably tested, scores of different package systems over the years. And realistically, nobody wants to fill water into their blisters. So that's the first issue. So the question is, how do we create samples? Um, and what we've done here at CS Analytical about a year ago, and have been running successfully for about a year, is performing that service on site in the lab. And so the way that we work that is we'll typically request technical drawings to evaluate. The client provides us with formed cavities and lidding material. We make custom tooling, as you can see here. This is our little lab scale blister sealer. I will have custom tooling made, and then we can be the one to micropipette, a couple hundred microliters of liquid into each cavity, seal it, extract it, and then recover that solution for analysis. The benefits of this approach, doing this all in a lab setting, is that there's no need for line downtime. There's no need to, let's say, seal empty cards and then inject water into each cavity, which comes with its own risks. You have to reseal that injection site. So you risk losing the water through that hole that you just created. We also risk any sort of interactions with the adhesive that we use to seal that injection site, which could potentially impact results. There's also this concept of even if we are able to, at the manufacturing site, produce water-filled blisters, well, what is the impact of that water being present for 2 weeks as it's shipped from the manufacturing site to our laboratory and then placed in autoclave or oven, extracted and tested? Is that really an increased extraction period relative to what the chapter prescribes? And so this particular approach of filling and sealing on site in the moment as part of the sample preparation process has proven to be really successful from a 661.2 perspective. Um, However, there are still challenges, especially for very low volume or small blister cavities. So for all of the tests that 661.2 prescribes, we need about 120 to 150 milliliters of solution C1. So that means I need to fill enough cavities to recover a total of about 150 milliliters. For cavities that I can fit, 300 microliters, half a milliliter into, that's manageable. But for really, really small volume blister cavities, I was just having a conversation with somebody recently where the cavity size holds 20 microliters. That would take about 7,500 cavities filled just to obtain the appropriate quantity of solution for testing. That is just infeasible, both from a preparation perspective, but also from a recovery perspective. What is the chance that I'm going to actually recover 20 microliters from 7,500 cavities? And also, is there a risk of potential interference or contamination from that rather extensive process? Can that even be done within 4 hours, which is the limit of the test solution that it is good for? So from a routine testing perspective for small volume blister cavities, this isn't really an ideal scenario. And what are the alternate approaches? Well, we can possibly test as a component, both the forming and the lidding material, but then we get into those same issues where, for example, I could be extracting the paper layer or adhesives that are on the other side of the foil from the product. The foil typically is considered impermeable, so the adhesive, the PET, the paper, for example, in this example here for the lidding material, it wouldn't really be appropriate to submerge that in water and extract that under 661.2. Can we create larger cavities and test larger cavities? Logistically, sure, we can do that. But then there's also language in the USP that says if you do that, you must consider the solvent to surface area ratio, which can be complicated, frankly, and also very costly for people to come up with new forming webs, etc., just to test for 661.2. Um, One potential other option would be to isolate the layers of interest and test them independently. So, for example, this heat seal layer, typically a polymer, can we isolate that layer and test that by 661.1, for example, to characterize it from a physical-chemical perspective and say, okay, this material has been characterized, it's applied to foil, which is impermeable, and therefore we're confident that this multi-layer structure is suitable for its intended use. The challenge there is that the end user can't really isolate that heat seal layer from the foil once it's been produced. And so that leads to our next challenge, which can be obtaining upstream data. Um, as we go from, let's say, a resin manufacturer who's creating that base resin with some additives, going to the component manufacturer who's, let's say, adding colorant and processing aids, or maybe co-extruding a multi-layer structure, and getting to the end user, it's ultimately that end user who is responsible for demonstrating the suitability of their packaging. However, it's expressly permitted in the chapters that the data could be obtained from realistically anywhere, which means from suppliers. So if you have, let's say, a resin manufacturer who also is generating 661.1 data on that resin, it is permissible under the USP framework to leverage that data on the base resin as part of your overall evaluation. But by no means is that resin manufacturer responsible or liable for generating that data. And so it often becomes a business case for these resin and component manufacturers. Does it make sense from a business perspective to generate that data and be able to include that when selling to certain customers, for example, the pharmaceutical industry, and what percentage of their business is pharmaceutical versus food, where 661 might not be relevant. And so it's not the case that every supplier wants to or will include that 661.1 data on their materials. Um, this can be challenging because also it's those suppliers that have the direct knowledge of what additives and processing aids are being used. Sometimes it's the suppliers only that have the direct knowledge of what that specific material of construction is. In the case of heat seal layers, that's oftentimes how they're described, as a heat seal layer, not necessarily what specific mixture of polymers and additives might be present in that layer. Um, and so this is even more relevant, as I had previously mentioned, for those multi-layer structures, where as an end user, it is impossible for me to isolate that specific material from the broader multi-layer structure. And so I've seen over the years some challenges in kind of getting insight into that upstream process when we're all the way at the end use case on the resin, on the component, and any additives or materials that are used along with it. And so that also kind of speaks to the concept of establishing a test matrix. It's the expectation for December 2025 that currently marketed products and pending products would be supported by the new 661.1 and 661.2 chapters. The grandfathering clause was removed, as we had previously noted. And technically, if you follow 661.2 per the way that the chapter itself is written, 661.2 should be performed on each unique package system. So if you have a 30, a 60, and a 120 ml bottle, the chapter is written such that those results that you generate are only relevant for that 30 ml bottle, or that 60 ml bottle, or that 120 ml bottle that you just performed the test on. However, in 1661, they do provide some guidance here that I think is valuable to many organizations who are in the situation of updating their data. And it's kind of small here, but the statement in 1661 says that 661.2 provides holders of packaging system or drug product applications with the flexibility to operate within the context of their own specific situation and their own specific risk management philosophy. The trade-off for having such flexibility is that it is the responsibility of such holders to justify the methods and acceptance criteria that they use. And it is proper and appropriate that the justification exists on the basis of scientific and risk management merits. In other words, 661.2 and 661.1 allows for some of that flexibility in risk management. And so for a new product package system, 661.2 is straightforward. Perform 661.2, that's perhaps overly simplified, but you're good to go. However, if you have, an existing product range where you have dozens and dozens of SKUs of different package components that are mixed and matched for different types of products, how do you go about updating these test methods while balancing the actual risk to the product and the patient, but also cost and the intensity of testing? And so, as an example of this again, one way that some of our clients approach this is the concept of a matrix. So, for example, we can perform 661.1 to qualify common materials. If we have a range of bottle formats, shapes, and sizes that are all made out of that same high-density polyethylene material, let's qualify that high-density polyethylene material to 661.1. At the same time, if we're making or we are buying multiple size packages made from that material, maybe we can bracket those individual package systems on the other end. And so what we establish is confidence in the material of construction that's being used across that range. And then we select perhaps the largest and the smallest packages within that range for 661.2. And then the justification there is that the material's qualified, we've looked at the extremes, and therefore we can be confident that those bottles manufactured in intermediate sizes out of the same materials should also be suitable for their intended use. This is something that needs to be considered on a case-by-case basis, but this, in conjunction with, let's say, historical data, stability data on products that have been in these container systems for years, these things can be considered in tandem to help paint the overall picture of why your plastic packaging system is in control, has been well characterized, well evaluated, and is suitable for its intended use. And so this slide is a slide that oftentimes I show during presentations related to container closure integrity testing, but it's really just as relevant here. Good quality by design, evaluating the risks throughout the life cycle of this product package system and saying, okay, how do we mitigate those risks through appropriate testing that's tied to both scientific rationale, tied to risk, but also realistic to apply in the real world. And so at the end of the day, justifying your approach to qualifying your package systems is going to be critical. These chapters have been delayed for quite a while now at this point. We're coming up on 10 years since they were first put out there as official in 2016. And they've changed over time. There's two comments that I have on that. One, I am not aware of any organization that has filed with updated tests under 661.1 and .2 that have been rejected as a result of some of these changes. So at least observationally, it appears that adopting these new test chapters is viewed favorably as a replacement to 661, even if there are some subsequent changes to those chapters since they were first released. That concept of early adoption is still well supported. The second concept there is that when we're talking about that life cycle approach, it is important to kind of evaluate what can go wrong and how it is being mitigated. Excuse me. Excuse me. So what data can we generate on the different materials, on the different package systems, to provide overall confidence in that approach? So some quick conclusions. Numerous USP chapters have been and are currently being or are intended to be revised, as I mentioned earlier. The general approach is less prescriptive, which does put more onus on manufacturers to develop and justify their testing strategy, as well as the results that that strategy generates. However, this can be both a frustrating and freeing thing. There are still quite a few challenges that persist. In my opinion, the correct path forward is one that can be justified. And CSA remains engaged with the USP and industry to identify trends, identify issues, some of those that we just discussed today, and assist in the development of novel solutions and overall test strategies. One point that I meant to make on the last slide is that because these chapters are not technically official yet, it does still remain to a certain extent to be seen how FDA will enforce these. Um, they're, as we were mentioning before, 661.2 technically is written in a way that every single package system should be tested by 661.2. Realistically, is that something that the FDA is going to expect? Probably not. They're probably going to take more of that risk-based approach and expect that people can justify what they've done. But it does remain an open question that does need to be seen once these chapters do become effective. A quick note regarding some of the services specific in this space that we offer. So CS Analytical, we can collaborate with you to define and implement a strategy for a specific product package system, a product line, perhaps looking at different package systems for the same product, or a product portfolio, preparing for complete 2025 adherence across the full range of product package systems in that organization's portfolio. As referenced in one of the first slides, 661 is only a portion of that overall container qualification strategy. And so we also do have the opportunity here to build out complete container qualification programs in a one-stop shop model. We can evaluate 661, but we can do everything else that's also going to be required for that specific material or component. So pricing and assistance with development of a test matrix, any specific tests are always available upon request. And so that, I thank you for your attention and time today. Do please feel free to reach out. You can email us at engage@csanalytical.com for a visit to our facility if you happen to be close by, or a conversation on some of the topics that we discussed today, or anything related to testing of a package or container system for life science industries. So with that, there are a few minutes left that we have here, and I can take a few questions or conversation if anyone has any interest.
Hello, Brandon. Do you hear me?
I can, yes.
Hi, this is Hadi from Apotex. Thank you very much for your presentation. It was really informative to me, like always before. So I have two quick questions. One of them is about the field size we need to use for 661.2. If, for example, I have a bottle 500 ml and I'm using it for 3 different products with different fill sizes, what fill volume shall I use? 500 ml for 500 ml bottle, or if my minimum fill for a product is, for example, 400, I should recommend the contract lab to put 400 ml in 500 ml bottle and test it. And the second question is about the temperature. The incubation condition we use for 661.2 can be arbitrarily switched from, for example, 120 to 70 degrees and longer incubation period, or there is a special rule for that? Thank you very much.
Sure. So to address the question first on fill, This is something also that, in my opinion, the USP across the different chapters needs to harmonize a little bit better. The description of fill, there's the concept of nominal fill volume. There's the concept of target fill volume. There's the concept of brimful capacity, overflow capacity. And so, frankly, across the different USP chapters, there are a lot of different potentially conflicting ways in which volume is expressed. Realistically, the way that I've seen 661.2 performed on these types of package systems is based on the nominal volume of the package system itself. So in the case of that 30 cc bottle, that 30 ml HDPE bottle, for a solid oral dosage form, we would fill it typically with 30 milliliters of water, recognizing that that's not the brimful capacity, but that is its quote unquote nominal volume. For liquid-based products, uh, you know, that also has a unique consideration because you do typically have the target fill established as a volume. However, in most cases, I do see it applied based on the container system's volume itself and not necessarily specific to the fill level that is going to be put into the container. Historically, although there absolutely are cases where we would use that target fill level, especially for something, let's say, like a tube, which is described as a 2.5 gram tube, but is filled with, however many ounces of a liquid or cream. So in a nutshell, it does depend a little bit, but I would say historically, it's mostly been that we would fill to the nominal volume of the container system, not necessarily the product that's being put into it. Although I can absolutely see a case for evaluating it based on the product fill specifically. Um, the second question that you had regarding the parameters for the heat. So the way that 661.2 is written, it says, start at 121 in an autoclave, and that if that temperature, quote, leads to deterioration of the sample, you can go to the lower temperature. Now, for certain types of plastics, we just know based on experience that if I put, let's say an LDPE container into an autoclave at 121, I'm probably going to get some deformation and disintegration. So there are certain types of plastics that typically we know, all right, we're just going to start with 100. A lot of blister cards, similarly, can't really withstand 121C. You put them in there, they come out flat as a pancake, melted. So the way that it's written, it does say if there is deterioration. What I've seen more recently, and I think is something that I would expect to catch on, and I actually think that hopefully there's an opportunity to discuss this in either 1661, if there does happen to be another revision, et cetera, has to do with anticipated conditions of use. So another way, again, more recently that I've seen the condition justified is, if I'm going to be qualifying, let's say, this blister card for a solid oral dosage form, under what set of circumstances is it ever going to be exposed to autoclave conditions at 121? And so in certain circumstances, especially as of late, I've seen justification on that condition based on kind of anticipated conditions of use, where I'm never going to be autoclaving that particular product package system. And so maybe it's suitable to justify a lower temperature based on the fact that that package system is not ever expected to exceed, let's say, 100C. Now, realistically, most package systems are never going to be expected to exceed those values. And it is an extraction test, so the temperature is intended to promote the extraction of materials. However, because these specific temperature and time profiles are included in 661.2 as corollary options, I think it is fair that they should be viewed as equal alternatives, you know. And so that's my answer on that. Historically, it's based on quote unquote deterioration of the sample, but I have seen, especially recently, more situations in which that extraction temperature is justified based on the conditions that that material or component might experience over its life cycle. Any other questions, conversation topics from anyone on the call?
Hi, Brandon. This is William here from Ando. Please, can you
Hello.
confirm like what would be the frequency of testing? Should we perform the on each lot, or can we do it on annual basis? This USP 661.1 and 2.
Yeah. So there's nothing in the chapter that would specifically dictate what that is, what that frequency should be. And so I think that this more so speaks to kind of your control strategies. I have seen over the years, even with the old 661, or even with other types of packaging components and other chapters like 660 for glass, different companies take different approaches. So there are some organizations that do, as part of their control strategy, for example, test each incoming lot, or requalify on an annual basis. There are other organizations that I've seen that have very specific agreements in place with their suppliers, that state, that everything will be managed by change control. So if they've qualified a specific material of construction and a specific component or package system made with those materials, and you can prove control over that life cycle such that if there is a change to anything, there would be a management of change and you would evaluate the risk of that change. I've seen some companies that don't perform this type of testing on each lot or even an annual basis. So I think ultimately there's not necessarily a right answer there, but it speaks to that overall risk assessment and your overall control strategy for your container systems.
Hey, Brandon.
Hi there.
Sorry, it's Robert. One quick question. USP 661.2. It's been some questions for us. There's no ID test, and the last thing you want to do is put together a 661.2 point, and then have the FDA ask you, well, what's the identity of your material, and how do you know? Can 661.2 stand on its own?
So 661.2 should theoretically be able to stand on its own. But what I often see is that the ID tests are still performed frequently, especially as something like incoming inspection. So if somebody buys, a batch of HDPE bottles from DPG, they'll take one or two, send it to the lab, perform an IR, confirm it's HDPE. So it's very common for us, even if we're doing 661.2 on a package system, to also wind up doing identification testing on those individual components. So maybe the bottle itself, the liner of the cap, the inner shell of that CRC cap might be individually tested by ID and then assembled and tested by 661.2.
Good. That's how we've approached it, is that, this is, we don't want someone to say, well, what are you working with here and can you prove it? So, okay, good.
Any other questions, comments?
Hi, Brandon. This is Shane Messner. We had a question on bracketing recommendations if we have multiple bottle sizes in use. From the slides, it seems like largest and smallest could be used. Would you be able to expand on that and your thoughts?
Yes. So again, this is something that I would typically seek to consider case by case, but generally speaking, for an individual supplier and an individual material of construction, we could potentially look at taking that approach where, like I mentioned, you have the material from which those different size bottles are created qualified by 661.1, and then perhaps the smallest and largest bottle, which theoretically should represent the highest surface area to volume ratio and the lowest surface area to volume ratio, theoretically, to kind of bracket and say worst case, best case. On the final containers, here's my results. And oh, by the way, all of the materials that we're making these containers from are qualified across the board. But that is something that we would typically evaluate relative to the material. So if we're getting let's say, bottles of the same size from two different manufacturers, we wouldn't test one manufacturer and say that the other one is covered just because it's the same size or just because it's also HDPE. And so understanding kind of what that matrix is, both from a size and format perspective of the bottle, but also the materials and the suppliers that are used to create those components. Both of those are relevant when we establish a matrix that, can be defended, in my opinion.
Thank you for explaining that.
Sure. All right. We have a few more minutes. One last check. Any other questions, comments, discussion
Yeah, Brandon.
topics?
Can you hear me, Brandon?
I can, yes.
Yeah, it's Dave Furmeister from Pfizer. I guess I haven't seen a whole lot on 662 yet for metals. In your opinion, what do you think that's going to impact around testing blisters and potential foil like tubes that have metal in them? Is there going to be something different coming down the pike?
I am just as curious on that topic. So, funny enough, I had a conversation with somebody last week about this specifically. And this person had mentioned to me that had some sort of discussion with USP present that there was reference to 662 and it potentially being suitable for testing these types of components. However, I have not seen 662 yet. So I actually reached out to Desmond at USP this week and asked about the status of that chapter because I want to get my eyes on it. And supposedly it's going to be out for comment this summer, next month. The thing that I'm curious to see about 662 is how it delineates between metal components and plastic coated metal, which is what we see most of the time. So if 661 is meant to test polymers and 662 is meant to test metal, well, what happens when we have that foil with a polymeric heat seal layer on top of it? Or an aluminum tube with a polymer coating on the inside? So I'm curious because is there a potential that 662 provides some insight into how to evaluate these? Possibly. But I could absolutely see how for polymer coated metals, since the polymer is the product contact, that 661 on that polymer would still be required. And I'm also curious to see how 662, or if it even does, address polymer coatings on metal. So that's something that I am very interested to find out, but I don't necessarily have an answer in terms of whether or not that's going to immediately impact the strategy that we typically follow.
I think we got the same questions as you. Yep. Thanks.
Sure.
Brendan, hi, this is Merritt from ICU Medical. Can you hear me?
I can, yes.
I had a question about the if you had any insight on 661.1.2 testing and ink or printing on the primary enclosures. If this is like something that I'm not sure if it's like described at all in the document or if it's something you have insight on in addressing that.
Yes. It is loosely alluded to in the chapters. There are, I shouldn't speak off the cuff. I should pull up 661.2 to look at it, but there are statements regarding like associated packaging components, plastic overwraps, stuff like that. Realistically, I don't see people typically test with like a label applied to an HDPE bottle, in full disclosure. Possible exception to that would be something like a printed tube where we have, let's say, a polymeric tube and there's some printing on it. Oftentimes there, we will receive the tube with printing on it and potentially evaluate whether there's any dye migration, although we wouldn't necessarily state that that's the intent of the test. It's really the intent just to have the most final finished package system that happens to have the printing on it. So there is some language in there, but what I guess I would summarize to say is that I do not see people typically apply labels, especially to things like bottles, etc., as part of the 661.2 test specifically. Did that answer your question?
Yeah, I guess, we're trying to consider, we print directly on some of our primary closures, and we are thinking about bracketing to address all of the configurations there, if that's necessary, for the, to satisfy this testing.
Sure. So, I'm not familiar with your specific use case. I'd be happy to chat more about it, but generally speaking, the concept of looking at dye migration is relevant. So whether it's something that's performed under 661.2 specifically, or potentially as part of like an extractables or specific migration study, it's certainly something that could be evaluated, and realistically, probably something that could be bracketed. But I would seek to understand specifically your use case and matrix a little bit better before personally issuing any sort of recommendation. All right. I think we have time for maybe one more question or comment if anybody has one. All right.
Last one, Brandon. Last one.
Go for it. Sure.
There used to be a provision if you had used food contact materials that you may, you didn't have to do extractables and leachables. Is that still in play?
In my personal opinion, yes, especially for solid oral dosage forms.
Okay.
There is language in the USP 661.2, which doesn't explicitly say that, but gets pretty close. It points you to the chapters on extractables, which also discusses the concept of risk based on dosage form. And
Okay.
from the risk perspective, solid oral dose is very low from a potential interaction. And also, it is kind of in the same vein as food. What is the functional difference between putting a tablet in that bottle versus a food item in that bottle? Not much. And so, especially for solid oral dosage forms, but also in many cases for liquid oral dosage forms or topicals, all those lower risk applications, I do see references to food contact being made in lieu of pursuing a full extractable study, and that is what I would personally recommend for those types of forms personally.
Okay, thanks.
Sure. All right. Well, thank you, everybody. It looks like we're coming to about 11:30 here, so I want to respect time. I appreciate everybody that attended. By all means, as I mentioned, feel free to reach out, follow up on any conversations. If you'd like some slides, anything like that, just shoot us an email, give us a call, and we're always happy to engage. So with that, thanks again, and hope to see you on our next webinar. Take care, everybody.
Thank you.